Hello and welcome to this OncLive Peer Exchange, Advanced Lung Cancer, a Year in Review. I am Dr. Nair Rizvi from the Herbert Irving Comprehensive Cancer Center at Columbia University. Joining me today in this virtual discussion are my colleagues, Dr. Joshua Baum from the University of Pennsylvania, Dr. Leora Horn from Vanderbilt University, Dr. Tim Cruiser from Northwestern University, and Dr. Jacob Sands from Dana-Farber Cancer Institute. Today we're going to discuss a number of topics pertaining to the treatment of advanced non-small cell lung cancer as well as small cell lung cancer, and discuss some of the recent data that has been emerging and how we make decisions around treatment. Let's get started on our first topic today. Really one of the first things when we see a new patient with metastatic non-small cell lung cancer is how do we approach that patient in terms of our workup and management. And maybe, Josh, maybe you could start with walking us through some of that.
Thanks. So yeah, when I have a patient with non-squamous disease, I do a comprehensive next-generation sequencing profile, which at our institution is a DNA-based NGS profile and an RNA-based fusion panel. And those patients also have PD-L1 testing. For patients who are biomarker negative, I go based on PD-L1. So if they have PD-L1 greater than 50%, I tend to give them pembrolizumab monotherapy unless they present in extremis. And for patients who are PD-L1 less than 50%, I give them histology-appropriate chemoimmunotherapy, usually either carbo-pembro or carbo-pac-pembro.
Josh, you were saying that you do a DNA-based and RNA-based test for all your newly diagnosed patients. Can you tell me a little bit more about what the RNA test is for?
Yeah, so the RNA test has a much higher sensitivity for the detection of fusions and translocations, which can happen rather frequently in patients with non-squamous non-small cell lung cancer. So actually, if I have a patient who has had a DNA-based assay and I suspect that there's a fusion or translocation, I will sometimes repeat our RNA-based assay and have found fusions in that fashion.
We do something similarly, but if we find a KRAS or EGFR mutation, we don't do the RNA based assay because it's unlikely we're going to see anything more. Leora, is that similar to what you do in your group?
Yeah, we're doing the same thing here as well.
Okay. Jacob, any other biomarkers you feel are important up front? So we've got the DNA-based test, we've got the RNA-based test, we have PD-L1 testing. Anything else that you use to inform treatment decisions?
I think those are obviously the most important ones. And one thing I'll just add to that actually is I'll say that even in people who have squamous, who are never smokers or light with a distant history of smoking, we do test those as well. And then we had a recent publication in lung cancer looking at our squamous cell population and going back and looking at NGS testing from those. And interestingly, there are some where it looks like it's probably more a metastatic skin cancer or something else like that, particularly in these light never smokers. And so just to consider that there can be other possible sources of that, particularly in that population. And we saw a UV signature on the NGS panel within that, and then looking back, they actually have a history of a squamous skin cancer that had been resected. And so sometimes the picture isn't quite as clear and it takes a little bit of digging as well, but we as well, NGS panel and a PD-L1 expression.
And do you report out TMB, or do you use TMB?
Well, it is reported out on the panel we use internally. I'll say I don't yet really see a great reason to use TMB. I don't think it's quite clear, and it's not really just a tool for driving decision making at this point.
Yeah, they just added TMB output to our internal panel. And we had a whole talk about when are you going to use this? We've put in all of this work. And I said, I don't think I'm going to use it right now at all, unfortunately. But I see it, and it is a thing on the page at this time.